You're watching Do's and Don'ts with Dr. Anderson.
Hey, I'm Dr. Nicole Anderson, and vibration technology is everywhere now. So many people are buying vibration tools. I wanted to do a quick little video on what to do and what not to do, because you can actually injure yourself with vibration. One thing just right off the bat, if you have had hip replacement surgery or knee replacement surgery or shoulder replacement, any kind of implant put into your body, talk to your medical doctor, talk to your surgeon, and ask them when it's okay for you to do vibration, or if it's ever okay. Please. That's very important. All right, there's other contraindications, meaning don't do this, never do vibration, all right, for certain people and certain things. So there's certain people who should not do vibration. There's certain conditions where you should not be using vibration. So ask us for our free report on vibration to find out when it's safe and who it's safe for, so that you're not potentially really hurting yourself. Anyone can buy a vibration tool. Not everyone should be using it. Okay, so I want to talk a little bit about how to use it effectively and common things that people do to actually make the pain worse if you're trying to solve pain with vibration, which none of us want to do, okay? None of us want to make it worse. All right, so these are some very bad ideas with vibration. So number one, do not apply vibration to an area that you have just recently injured. So if you don't know the difference between injury pain and like a sore muscle from exercise, basically a simple way to discern the difference is if you were doing something and you felt a sharp pain or you felt a pain right afterward, you probably caused an injury. And if you caused yourself an injury, or if an injury happened to you, do not apply vibration using your whatever vibrating handheld tool you have. Do not apply that right to the area. So for example, your shoulder, you do something, tweak it, maybe lifting something heavy or whatever. And I have had this phone call. Someone called me, they're like, I was lifting something heavy, tweaked my shoulder, and I applied my Theragun right to that area. It's a wonderful tool. Bad idea to do it right after an injury. What you should do is wait for 14 days to let that thing calm down. You can use indirect. You can go indirect by doing vibration to other areas of your body, and I'm gonna go over that. But definitely don't apply the vibration right to the area unless you first get it cleared by a physical therapist. So if you have any questions about whether it's okay to put vibration on an area that hurts, I would definitely reach out to us, ask for a free phone consultation, and we can talk with you and figure out whether it's safe to apply or whether it's better for you to go with an indirect method. So the right way to use vibration if you have had an injury very recently would be to be very indirect with it. And I would even be careful even to recommend using vibration if you've had a recent injury, because the vibration is actually moving throughout your body. You might not realize it, but if you're applying, because of the way your body is designed, let's say you injured your hip and you apply vibration down here, that vibration's still traveling up towards your hip, and it may not be a good idea for you to be doing that. And the only way that we would know for sure is if you check with a specialist, physical therapist, to help guide you on that. But in general, if you have a sore area, just general principles for using vibration. If you have a sore area, let's say it's just soreness from a workout, then what you want to do is start indirect. And the reason is because the way the nervous system is wired, if you have an area of soreness and stiffness, your body is wired to keep it protected, because your body is wired to stabilize with a little bit of bracing any area that needs to heal itself. And soreness is a little bit of a micro injury to an area, and so your body is bracing around that area to help it to heal itself. But in the case of muscle soreness, it doesn't need to be doing that. So what you can do, if it's just muscle soreness after a workout, is you want to start with vibration further away from the area, so more indirect rather than direct. Let's say I had lower back pain. If I was going to be direct and I had lower back pain or stiffness, then to be direct, I would lay on my side and I would apply the vibration, kind of like this. You don't want to apply vibration. Here's a don't. Don't apply vibration right on a joint or a bone, unless you have this really cool tool This is called the Pure Wave, and they have a newer version that's even better. And here's something really cool about vibration is vibration is a resonance. For vibration, there's multiple different effects that different vibration levels can have, different frequencies. And this tool, the thing I love about this tool is this goes at 10,000 RPMs and it is at a really low amplitude. So it's very small vibration wave and it goes really, really fast. All right, and the good thing about that is it has specific effects on the tissue and stimulates healing in specific ways. It's especially good at the highest level. If you turn it all the way up to 10,000 RPMs, it's especially good for actually stimulating a reflex in your body that will cause muscle spasms to instantly release. That's what this tool does. This is a really cool tool. Not a lot of people know about it, but we use it here at the clinic and I recommend it to all my patients. So this one you can actually use right on your face, you can use it on your head, you can use it on your joints. But those Theraguns and those guns that do like this bumping thing, right? They have a lower frequency and they have a higher amplitude. And you don't want to put that right on a joint or a bone. That could cause damage. So don't do that, all right? But it might feel good at the time. And I get a lot of people that talk to me and they say, hey, my neck was hurting, so I put my Theragun or my vibration gun like right on my neck. And it felt really good at the time, and now my neck is killing me. It's worse than before. I'm like, yeah, don't do that. Don't do that, please. So what you would do if you do have a Theragun or one of those gun type vibration tools, which this does that type of amplitude and frequency that the other guns do, it does it here, but it has this other side to it that causes instant like reflex release of muscle spasms, which is phenomenal. And you can use it right on bones and joints as well, which is really great. But if I was gonna use this end of it, or if I had a tool that only had this capability, then I would, if I was trying to help my neck, I would lay down, number one, because here's a principle for vibration. Let's think about this. I'm trying to get a tissue that is kind of stuck together in certain layers. I'm trying to get those layers to release and loosen up, okay? And it's going to release and loosen up a lot better if it's on slack. Think about it. If I compress that tissue, or if I put it on tension, now it can't vibrate as much. Think about like, if it's on tension, it's like a drum, right? It's not gonna be able to vibrate as much, right? If it's compressed, then we can't get as much vibration. The more vibration we can get flowing through the tissue, the more it's gonna release. So what I would do if I wanted to release my neck, I would lay on my back and I would lay without a pillow. Notice that my pillows are over there. I would lay down and use the opposite side hand so that this side, let's say I'm treating, my neck pain is more, let's say my neck pain is more on the left side, all right? Then what you wanna do is, if it's on the left side, I'm gonna use my right hand, and I'm actually not gonna go right to the area. I'm gonna first do some release to my chest muscles. I'm gonna come in and do some release on pectoralis minor, which is kind of like right near your armpit. Do about 30 seconds in each spot, and it's better to do multiple spots than to just stick to one or two spots. It's better to do short periods of time and hit multiple areas because your body is really interconnected. And by releasing multiple muscles around an area, you're actually gonna get a full release versus just targeting the area that hurts. So I would start with chest, and then I would go into pec minor. Then I would come onto the bicep, do a little bit of vibration there, and you can move it around until you find an area that feels sore, and then leave it right on the sore spot for about 30 seconds until you feel a release, or just leave it for 30 seconds. And then after I do the bicep, I would move out to the outer part of my shoulder. So I'll show you on this side. Okay, I would move out here to the deltoid and I would release some of that. Okay, and then I would lay on my side and I would get the tricep, and you want that tricep to be on slack. So if it's here, it's not, it's on stretch. So I would have it straight. I'd work through here, again, looking for sore spots. You're probably gonna find more of them up high in this area, near the shoulder. Or I'd also do diaphragm. Okay, so I would do some release of the diaphragm. Again, if I have pain more on the left side, I'm gonna be using more of my right hand so that this side can be chilling. We want this side to be totally chilling, okay? So then we're gonna do some release of the diaphragm, because releasing your diaphragm actually has a tremendous effect on releasing your neck and your shoulder. Last place I'm gonna go is the trapezius, which is a muscle here in your upper trap, and also you're gonna get some levator scapulae. So in order to release this optimally, what we're gonna wanna do is, let's say my pain is more on the left side. I'm gonna side bend my head a little bit, and then I'm gonna rotate it away from the side that's sore. Just a little bit, not extremes, okay? And it shouldn't be painful. It should actually kind of make it feel a little bit better. Then I'm gonna take my tool and I'm gonna apply it right to the middle part of the muscle. Just let it vibe, about 30 seconds or so. And that's it. That's how you would actually treat your neck if you had one of those gun type of vibration tools. So you want to start indirect. You don't want to apply it right to the bone. Don't apply it right to the joint. And if you have an injury, don't apply it right to the injured area till you get cleared by a specialist physical therapist who can tell you, yes, it's safe to do that, because it really might not be safe to do that for a couple weeks. And even then it might not be safe to do it, because sometimes when you injure tissue, it can take 4 to 6 weeks for it to fully heal, and we don't want to apply vibration during that time. But there's other tools that would be great to use. And one of them would be this really specialized electrical stimulation that we have here at Anderson Sport and Wellness that no other clinic in Orange County has. And it can be used the day an injury happens, and it can get rid of muscle spasms, gets rid of pain, stimulates the healing response of your cells. At the cellular level, you're healing much faster than if you didn't have this applied, and it doesn't take long to apply it. So that would be really a good thing to use versus vibration if you just had a recent injury. All right, so have you ever, vibration edition, I see this a lot. So people are trying to loosen up tight quads, right? They've got their vibrating roller and they're doing this. It feels good. And a lot of things that feel good actually aren't the best version or the best option. There's a lot better option for getting a release in your quads. The reason is because your soft tissue that you're trying to vibrate by laying on it is actually getting compressed, so it can't vibrate as much, and you're not getting as good a result as if instead you would lay on your back, take your roller, put it here, block it so it can't roll down onto your feet, and just chill. And then move it to different spots and leave it. That's gonna get you a far better result. Have you ever wondered how you could release this inner thigh area here using your vibrating roller? You've probably tried all kinds of things, you know, like something like this or whatever. All right, the best way to do it if you want to release your inner thigh would be to lay on your side and just rest your thigh on it very gently. Now that vibration can flow all the way up into your hip, up into your lower back. You're gonna feel it releasing not just the area where the vibration is, you're gonna feel it releasing all the way up into your hip, your lower back, your shoulders, neck, even down into your feet. And by the way, inner thigh is key. If you're not currently using your vibration tool to release your inner thigh, you're missing out on releases that could be helping your knee, could be helping your feet, your shoulders, your lower back, your jaw. So inner thigh is really, really key. Another option for inner thigh, you could just rest it kind of between your legs like this and move it to different spots. You could rest it this way too. And it's a good idea to vibrate the lower part of your leg on the inside because that fascia is connected. Your inner thigh fascia is connected all the way down into your feet. So by releasing this area here, which gets a lot of wear with everyday use, then you're going to actually help release the tissues elsewhere as well. So you can take your vibrating roller or ball and you can place it so that it's vibrating that way. You can lay on your back and rest your feet on it. That's very effective. And if you wanted to release your hamstrings, don't sit like this, okay? Because again, now you're cutting off the flow of the vibration. It's getting to your hamstring, but it's not getting to the other parts of your body. Just try it. Test me. Just try it. So if you do it this way and then lay down like this and rest, you're gonna feel that vibration flowing through your whole body. You're gonna get whole body releases a lot better than if you're sitting like this to do it. Plus, when you're sitting this way, it's kind of compressing a little bit. So it's better to be like this. So in summary, when you're doing vibration, just a few little tips. Think about trying positions where you're not gonna be compressing the tissue while you're doing it. You can get creative, just be careful with vibration. You don't wanna be applying it right to a bone or a joint, unless you have this really cool tool, the Pure Wave, because it has, on this end, it vibrates at a certain frequency where you could apply it to bones or joints. But these other tools that vibrate at the 3,500, 3,700 frequency, not so good. Don't apply those to your bones or your joints. That could damage you, all right? The other key thing to think about is you wanna go indirect before direct. If you have a specific area that's feeling stiff or sore, think about vibrating around the area first to other areas, then sneak up on it and get it last, because that's gonna soften and calm down your nervous system in the area where it's protecting a little bit more, so that the vibration can actually get in and do its job if you sneak up on it by releasing other areas first. So keeping in mind those keys, and don't apply right to an injured area before you check with your medical professional first. Those key things, really important, and that will allow you to get a lot more out of your vibration sessions and feel much better after you use vibration, and keep things from getting worse by using vibration, because that happens. I get those calls all the time, and don't let that be you. Thanks for watching. So if you liked this video, please like it. Feel free to subscribe to our channel. I hope you check out other videos that we produce. We're all about helping you get the most out of life and stay active, mobile, off of pain pills, and out of the doctor's office.